Good morning, or good start. Good afternoon, everybody. My name is Chris Jefferson, and I am an outreach officer for the College of Podiatry, promoting the I See the Difference campaign. Today we have a fantastic webinar lined up for you because we have a fantastic guest panelist who is an osteopath. Her name is Annie Osborne, so she's just going to say hello right now.
Hello, everyone.
So Annie has kindly given up her time from her busy schedule today to talk about her role, her journey to becoming an osteopath. Also, we have helping us today is one of my colleagues. Her name is Emily, and her role today is to answer any questions or field any questions that you might have during the course of this webinar. So good afternoon, Emily.
Afternoon. Hi, everyone. Like Chris said, if you have any questions, pop them in the question box and I'll try my best to answer them as we go, or we'll save them until the end and ask them to Chris or Annie.
Perfect, yeah. So if you do have any questions, there's an orange box with a white arrow on it on your screen. Type that in. Emily should acknowledge the question, saying thanks very much. And between me, Emily, and certainly Annie, that we will answer those questions. So the format of this presentation today, this webinar, is quite simple. I'm going to rush through what allied health professions are in as quick as time as possible, 10 to 15 minutes. From that, then we will have Annie talking about her role, her life, and the profession as well, and then a bit of Q&A. So hopefully by the end of this webinar, you'll know a lot more about allied health professions, and you know a lot more about osteopathy, and think, wow, this could be the career for me. That's the whole point of what we are doing. So I always like to start off our webinars by saying, well, if you are a student or if you're anybody, and normally you have a bright future, fantastic opportunities ahead of you. In fact, you have the whole world in your hands. If you go to school and come out with qualifications and go to university and come out with a degree and qualifications, in theory, you can take your skills, expertise, and enthusiasm anywhere in the world. Because we're not on this planet for very long in perspective of terms of like the age of rocks and things. The phrase has totally slipped my mind. But on average, we spend a third of our life asleep. And if you're in school, you spend one entire year, 365 days, 24 hours a day in school. But more importantly, you spend a third of your life at work. And so the simple philosophy of mine is, if you're going to spend a third of your life doing something, going to work, why don't you make sure that it's the best thing that you can do, the most rewarding, interesting use of your time. I have had many jobs in my life. I won't bore you with what I've done, but I've worked for charities, I've worked in prisons, I've worked in mental health, I've worked in law, I've set up my own business, I've done lots of things, I've worked with many people, and on the screen you can see 10 things which I think, and other people would agree, hopefully, what makes you happy at work. I'm not going to go through them all, okay? They're there on the screen and this presentation is being recorded. But having worked in organizations for maybe 4 or 5 years, I hit what is called a ceiling, therefore I couldn't go anywhere, and I was frustrated saying, I'm giving you all of my creativity, and they go, well, if you want to do something else, there's nothing for you in this organization, go and do something else for someone else. Oh, thanks very much. But the things you see up on the screen, being appreciated for your job, good financial security, interesting job, job security, good work-life balance, all these make a difference to your working life. And I would pretty much put my hand on the heart and say, if you're an allied health professional, all these things would apply for you. And hopefully Annie would agree. But most allied health professionals, they work or at least have the opportunity to work for the largest employer in the UK, which is the NHS. So over 1.3 million people work for the NHS. And it's not just doctors and nurses and midwives. There are actually hundreds of different types of career paths and jobs available, over 350. And one of the important branches of employees in the NHS are allied health professionals, or as I may refer to them, because saying allied health professionals all the time is just a bit tiring, I may refer to them as AHPs. What do AHPs, allied health professionals, do? Well, they're not doctors and they're not nurses, but they are professional experts. They have an expertise in a particular area or areas of the human body. So a GP, a general practitioner, i.e. your local doctor, is a generalist, if that's fair to say, where an allied health professional is a professional specialist. They may specialize in the eyes, the back, the spine, your muscles, your feet, you name it, we'll go through them, but they are professionals. And their job, like any person who works in the healthcare sector, is to help people recover or get better from injuries and illnesses. And there are 15 different allied health professions. You may have heard of some of these occupations, such as a paramedic, or maybe a radiographer, people who take x-rays or treat cancer, or maybe a dietitian. But I'm going to give you a quick summary of what all these different allied health professionals are, what their jobs do. So of the 15, what we like to do is say, listen, this could be confusing, hence that last slide, but we're going to break them down. So the first category are those AHPs, which use techniques to help others to help themselves. And as you can see on the screen, this would include art, drama, and music therapy, and speech and language therapy as well. So these professionals work with a whole range of patients from a whole range of conditions. Right now, today's webinar is not the time to go into too much detail about them, but if you are good, for example, at art or music, or you love drama, you could go to university and study art, music, and drama, and then you could do another 1 year or 2 year course and work using your skills and your ability and talent to help people recover from operations, prepare for operations, rehabilitate from injuries and illnesses. And the same with speech and language therapy. They're helping people with a whole range of communication issues, from babies who've been born with cleft lip palate or tied tongue, to people who've suffered strokes and other debilitating injuries and illnesses, who have lost that ability to communicate or have to relearn how to communicate. That is the job of a speech and language therapist. Then we have AHPs, which help people be mobile, stay moving, and ideally live independent lives. So we have dietitians who are not nutritionists. Dietitians are qualified in everything to do with diets. So people helping people, again, a whole range of conditions. They could be helping people lose weight or gain weight before or during or after operations. If you have various diseases, or you have various allergies to foods such as celiacs, or you could be gluten-free or gluten wheat intolerant, or you could be allergic to nuts. Dietitians are crucial in keeping the human body as well and as sort of operational as possible. If you ever suffer an injury or an illness and you can't get back to doing the things that you used to like doing, be it sport or even taking time off work, you might need to see an occupational therapist after an injury or an illness. And their job is to essentially problem solve and investigate and assess your lives. So they may help you get used to using new tools and new machinery at your place of work, or they would set you up with new equipment to help you live at home as freely and independent as possible. That could range from audible sort of cutlery and cooking equipment to stair lifts to visiting your place of work, making sure you've got the right type of support for your back or for your access into any buildings, and it can range from not only physical but also mental afflictions as well. Then we have our eye experts, who are orthoptists, slightly different from opticians who prescribe contact lenses and glasses. Orthoptists, I can't say it properly, orthoptists, they are expert in the eyes and the relationship between the eyes and the brain. If you have a really serious sort of eye visual problem, then they may refer you to surgery. But a lot of young people have come across orthoptists, maybe in school when you get an eye test, and the word orthos means straight. So orthoptists nearly almost trying to correct visual problems. So if you've got blurred vision or cross vision, they're the experts to see you. Then we have osteopaths, but Annie's going to talk to you all about what osteopaths do, but you can see they're related to, at least in some ways, manipulation of the human body and the spine and the skeleton, a wee bit like physiotherapists, but Annie will hopefully tell us the difference. And then we've got podiatrists, who are the experts in the feet and the lower limbs and ankles and toes. So the average person walks about 131,000 miles, 5 times around the world in their lifetime. So a lot of mileage in the old feet there, and it's really important that your feet are well looked after for a number of reasons. Then finally, on this category, we've got prosthetics and orthotics. A prosthetic device is a replacement limb. So if you've lost your limb through an accident or an illness or an injury, then ideally you'd have a new or replacement artificial limb created for you. Now that could be cosmetic, so it just resembles what you've lost, or it could also be functional, so to help replace whatever function of the limb that you're missing. And an orthotist is a person who designs and fits and manufactures a range of external bracing for different parts of your body. Now that could be something for your feet, for your back. Maybe Annie would have had experience in working with one of these types of allied health professionals, but their main aim, like most AHPs, is to help people live a full and independent life as possible. And very quickly, the last 4 of the AHPs are those that use active short-term treatments. So we've got 2 types of radiography. Diagnostic radiography are using X-ray, CT scans and other fantastic high-tech machinery in hospitals and healthcare settings to scan inside your body to work out what's wrong. So if you break your leg or break your arm, or you have lung cancer, you will have an X-ray, and that the diagnosis gets used to surgeons, doctors, and other allied health professionals. Therapeutic radiography is more cancer focused. 1 in 2 of us will get cancer in our lifetime. I've had people in my family die from it. I've had people in my family recover from it. And it is, even in today's world, the biggest killer of our population. So 500 people will die today of cancer, which is very sad and hopefully something which we will continue to battle against. Finally, we've got 2 other professions. We've got paramedics, which are the emergency responders. If you have an accident or an injury, or you need taken to hospital all of a sudden, these are the people who will stabilize you, assess you, make sure that you're ready to go into hospital and all the case notes and files and your medical history is all ready. And so they are crucial in responding to people who need urgent medical care. And last, but by no means least, we have operating department practitioners, and their role is to make sure that operations go smoothly in a hospital. And that could be from making sure that all the equipment is there, it's all working, which is always a good thing, it's sterile, that everyone in the operating theatre, from the nurses and the support staff and the surgeon and the anaesthetist, knows all about the client's history, if they have any allergies. And so normally the last person you would see if you fall asleep just before an operation would be the ODP, operating department practitioner. And when you wake up, they're there to make sure that you're in the right place and you're in the right way to recover. Okay, money. Money's not the be all and end all of life, but it certainly helps. And if you qualify as an allied health professional, you work for the NHS, which most allied health professionals do, here is a very quick picture of the salary bands. So when you start a job, you can see jobs advertised for between 15 to 30,000 pounds, but normally you start off at the bottom. And then after a few years, you work your way up and they go, hey, we like you, you're quite good at this job, we'll give you more money and more responsibility. As soon as you qualify as an AHP, you go in at a good level in the NHS pay band scale. So it would probably be the lower limit of the band 5, but as you can see, there is progression. And this is a crucial thing because, as I alluded to earlier, I've had jobs where I've been there for years and years, and probably because I was working for the charity sector, I end up with less money when funding was tight and things like that. But I've never had a job where they've gone, oh, you've done really well, here's more money, here's more responsibility, we really value you. So I've definitely been working in the wrong professions. The latter bands there, so band 8s and band 9s, are senior management levels. So you might be in charge of an entire department, entire sort of budgets, looking after hundreds of people. I apologize if you can hear scratching. My cat has just come in. If he jumps up on the screen, I'm really sorry. But yeah, so there's the salary bands. 1 in every 3 students complains about their university course, saying it's not value for money. And the great thing about being an allied health professional is that 92% of allied health professionals say their courses are great value for money. And so even if you do have to take a student loan now to help pay your studies, because you're almost guaranteed a job, you will be able to pay back your student loan as soon as possible. Right, I'm zooming through the rest of these slides just because I'm really keen to hear what Annie has to say. So why become an allied health professional? It's a great career. It's a career where it's pretty much a guarantee. If you go to university for 3 years and study as an undergraduate student, so a normal university course, you're pretty much 92% guaranteed to get a job. A lot of AHPs I've talked to and I've listened to through these webinars that we've been doing get offered jobs even in their last year of university. That's not because the jobs are bad. In actual fact, the jobs are the best that I've ever come across. It's just that there's a great demand for allied health professionals. And the crucial thing is, it's not about the money, it's about making a difference. If your life and your existence on this planet makes a difference to others, then you've done a good job. That's my own personal philosophy. So it's a good working environment. You're working with fellow professionals. You're doing something different every day. No 2 days are the same. As I said at the start, because you are a professional, in theory, you could work anywhere in the world. You could take your skills far and wide, to rich countries, to poor countries. You can help out anyone because your skills will be sorely, sorely needed in various countries. You have lots of areas and chances to develop into areas that interest you. So you might want to work with kids, or you might want to work with old people. You might want to go into teaching. You might want to go into research. You might want to go into development. You also might want to set up your own private practice, which means you may work for the NHS or you may not. You may work for the NHS part-time and then go, actually, I'm going to be my own business person. And I believe that Annie is a really good example of that. So not only is it a brilliant career, you are pretty much guaranteed a job after you study what you study at university. You can work in private practice, you can work for the NHS. You get to work with a whole range of patients. You are making a massive difference to their lives. Generally, and the exceptions to this are probably paramedics and diagnostic radiographers. Generally, you're working the hours of 9 to 5, normal core working hours. In terms of qualifications, well, each AHP has different criteria, and as does each university which offers the courses, but they range from C's at A level all the way up to 2A's and a B. And for certain allied health professions, you can also get paid every year to go to university, not to pay for your fees, but to pay for your living costs. I would say, and hopefully Annie will be able to go into more detail, skills and qualities needed. So for general AHPs, I think you have to be interested in people. You have to be curious, because a lot of this is going to be communicating properly with people, thinking, okay, so tell me what's happened, tell me your story, so you can hopefully come up with the right course of effective treatment. And you have to be committed. You're going to always have to be learning. There's always going to be new research, new techniques. But hey, I think that's really good. University courses at undergraduate, i.e. you sort of come out of school and you go to university, are 3 years long. And they're not what I would have done at university many, many decades ago, where you just sat at the lecture theatre and just tried to stay awake. AHP courses are really hands-on. They're a mix of lectures and tutorials and going out on placements and learning from your peers, learning from people who you've been work shadowing, and also treating real people. So the aim is, when you come out of university and you throw off your sort of hat and go, hey, I've graduated, you are there, ready to go, ready to work. And for that reason, the courses can be intense, but equally well, you come out of university, you're going to get a job, and you're going to get paid more than the average graduate. So it's well worth sticking through. So you can do 3-year courses at undergraduate level. You can also do postgraduate studies. Our website will give details of all the various places that you can study and what you need to do in terms of qualification and duration of the courses as well. And to find out more, this is our website, but I'll keep that slide up because I'm going to stop talking. What we're now going to do is introduce you to Annie. So there may be a slight delay as my colleague Emily gets Annie up on the screen and her presentation. But hello, Annie.
Hello.
Hello.
So I have been made presenter. I'm going to share my screen, and then you should be able to see my presentation there.
Can do, yes.
Fantastic. I'm going to get you guys back up as well.
I'm sorry to interrupt. I'm going to disappear my face, okay?
Okay, that's fine.
I'm still here in spirit.
That's fantastic. Can you still see my face as well?
Yes, I can.
Fantastic. So firstly, thank you so much for having me on this call. It's so great to be able to share what I do and inspire others to consider osteopathy as their profession. So who am I? As Chris has said, my name is Annie Osborne. I am a registered osteopath, and the first great thing about being an AHP is you get to have some funky letters after your name that looks pretty cool. So Annie Osborne, registered osteopath, and what that essentially means is that I get to help people move and feel better, to get the most out of their lives and to reach their full potential. Now, this for me is key, and this summarises what I actually do. And there's a few photos there of what actually involves day to day being an osteopath. Now, albeit now we're masked, gloved and aproned up, but it doesn't take away from the fantastic work that we are still doing, which is helping people's bodies perform better and on a deeper level work with them to, as I said, achieve their full potential and things they want to go through in life. So my journey so far. So I am relatively new to the profession. I have been graduated for about 18 months. I just going back on my journey during my school years, I was very, very passionate about helping others. I was involved in charity work, and I always wanted to give back where I could. As I was then going through school, I then did my A-levels. I did sciencey A-levels, biology, chemistry, psychology and food science. Was always very interested in the way the human body worked, as I've said there. And I was thinking, you know, what do I want to do? I'm not really someone who wants to be sat in an office. I'm keen to really, you know, put my skills into practice and have a career that I love. And that's where I developed a real interest in the human body. From there, I came across osteopathy, and I thought this is the best thing for me. I was looking into different options, but this seemed to fit my skill base and my passions perfectly. Moving on from there was university. Once I knew osteopathy was for me, it was a matter of finding where I wanted to study. And for me, that was a great place called BCOM, which stands for the British College of Osteopathic Medicine in London. And that is where I then spent the next 4 years. Now, I know Chris said there that it's 3 years, which is standard. However, now to train as an osteopath, it is a master's degree, and it's therefore an integrated master's over the 4 years, which again is a great thing because you've then finished your course and you have a master's qualification. So from there, and as Chris mentioned, the course was a mix between lots of academic subjects, hands-on, to really get that well-rounded education. And part of that was sports massage. We were taught in our first year how to deliver those kind of treatments. So from that, I gained valuable experience working with people and delivering sports massage therapies, and really got a feel for what it's like to be in a clinical environment and help people using hands-on skills. Fast forward through the course, I'll come on to what that involves in a moment. I then decided, or had a thought about what I wanted to do once I finished. Now, I've always been very passionate and very hardworking. I'm proud to be hardworking. And one of my goals was to have my own practice. And I was rare in the sense that I started that straight away, which is where I actually am right now, which is my clinic in Hertfordshire, which is Osteocure Clinic. And that is where I am right now. So I've been graduated for 18 months. I split my time primarily in my own practice and also working in another clinic doing hands-on osteopathic treatment. And what does the future look like for me? It's essentially expanding my business and helping more and more people in more and more ways. So, going through what the course involves. Studying to be an osteopath, as I said, it's 4 years, it is full-time, and you get an unbelievable amount of knowledge. I've spoken to plenty of people who are at university and they're very frustrated with 1 or 2 lectures a week. They're not getting much and they're paying an awful lot of money. That is the complete opposite of what it is when you are an osteopath. You are in, I'd say, 5 days a week, pretty much throughout the day, a mix between lectures, clinic, tutorials, just learning everything you need to be a great osteopath. It started raining and my clinic, you can really hear it, so apologies if it sounds like there's rain on the roof. And as Chris said, you graduate and day 1 you are ready to go, which is just fantastic. I remember back in my last year, no exaggeration, I was probably offered 7 different roles in clinics. I was very proactive and went out and networked with lots of people, because there's a huge demand for what we do. It was, you know, the world is your oyster when you leave, and you then get to pick what's best for you. Similar to what Chris was saying, osteopaths tend to work in private practice. There are some osteopaths that do work as part of the NHS, but most people do go and work either in a clinic working for somebody else or start up on their own. So if you are entrepreneurial in spirit and like the idea of being your own boss, osteopathy is great in that respect. So what does the course look like? So the first 2 years is mainly based around giving you all the knowledge so you're ready for clinic. What that looks like is anatomy, head to toe. You have to know every bone, muscle, artery, nerve, vein, you name it, you need to know it. Physiology, how the body works, different processes, how we function day to day as human beings. Clinical skills, so what you need to be able to test someone's body, diagnose that condition and give them the right diagnosis. Diagnostic skills and conditions, and also, most importantly, learning those hands-on skills that are going to equip you to help that person. The second 2 years are all about your clinical experience, building on those skills and developing further. So in those 2 years, there's still plenty of things to learn. You might learn about nutrition, about psychology, how to help your patients as a whole, but it's ultimately about giving you that hands-on to really feel confident to go out into the world and help people as soon as you graduate. So, a day in the life. So this is me now with my mask, my hand sanitizer, my gloves and my apron, and never go anywhere without my spine. You'll also see there my clinic, which is where I am sat now. You'll see here, this is my treatment couch. This is basically my desk. This is where my patients come in and we perform our treatments. And you'll see at the back there some posters. And one thing I think is so important is empowering people on what condition they may have or what we've diagnosed them with. So education for your patients is key as an osteopath as well. And finally, at the bottom there, being on calls with other professionals, doing video calls during lockdown as well, so we can still help patients, and ultimately enjoying and embracing life as a business owner. So as I've said there, clinic, rehab plans, doing notes on calls, meetings, blogs, and social media. Social media has been a great way to network and get out there and meet other professionals during this time. And as an osteopath, you are spending your day helping others, giving them answers and making them feel better. And this for me is one of the most incredible things about what we do, and what makes me so passionate is that you get to wake up every day knowing that that day at work you're going to make a difference to somebody's life. So often people may get up for work that day and they feel very negative and very low, and I strongly feel it can be because there's not a difference being made. And I love that I see the difference name of this webinar as well, which is key for what we do, and which is why I absolutely adore being an osteopath. And as I said earlier, decide on your own hours to suit you. This is one of the great things about working in private practice, is that you get to dictate when you want to work, which is great for trying to achieve that work-life balance and a role that you really, really enjoy. So my advice to you, limitations are perceptions. And what I mean by this is that it can often be overwhelming seeing these different options and how much it takes to be an osteopath, and wow, look how far that person's gone. And we can sometimes put limiting beliefs on our shoulders, but these are just perceptions. You are capable of whatever it is that you want. As Chris said, the world is your oyster, and if there's something that you love and that you are passionate about, go for it. You will do incredibly well in life if you follow your passion, follow your dream and vision for what you want for yourself and your life, rather than settling for something that you're not quite happy with. And as I said there as well, the only impossible journey is the one you never begin. If you've got that passion and you see the journey you need to go on, you are capable of that. It's just taking that first step. These webinars are fantastic for exposing you and introducing you to different options. And I hope you found it useful, me recapping what it is to be an osteopath. And I am 100% open to any questions that you would like to ask me about my role, what I do, and my journey to getting here today. So that is my presentation. I believe I can unshare my screen. Let me see. Shots. There we go.
Hi, Annie, can you hear me?
I certainly can.
Yeah, sorry, put your, let me just bear with it. Hold on, show my screen. Okay, so first of all, thank you very, very much. I love some of the quotes that you said there. You know, it's something I truly believe in. And actually, you know, it's almost like if you put your mind to it, you can do whatever you want.
Absolutely.
And yeah, so I mean, one of the things which Emily and I have both done, and hopefully our audience would be aware of as well, is that yes, we sort of promote allied health professionals as being mainly or largely the NHS route. Hence, we show the salary scales and things like that. But being an osteopath, it's quite different from that. You would say, do you know what? You know, how many people could you work for the NHS if you wanted?
Yes, it certainly is an option to do so. I don't know the figures 100%, but I'd probably say either 90%, 10%, or 80-20 in terms of NHS private practice. Osteopaths have only recently, I believe, been added to the AHP list, and I think osteopathy as a profession, I can see it being more integrated into the NHS going forward, but most people do work privately. Some osteopaths work in a clinic that is connected to the NHS, so for example, they may have a patient may have a referral from their GP to come and see you in private practice. So you're kind of working as part of the NHS. Other ones, you may be working more in private healthcare. So you're in your own clinic and people either come to you off their own back or they're referred from their private health. And that's the other thing that's great about osteopathy. The patients don't necessarily need a GP referral. You are a primary healthcare practitioner, which means they can come to you off the street and you've got the skills and capabilities to diagnose that patient and deal with them through their treatment process.
Which is what I was saying to you before the webinar started. If I've got a very sore back, could I come and see you? And you said yes, if I live nearby. So when given that a lot of, I'm just waiting for the audience to type in questions. So audience, if you do want to ask any questions, I'll ask Emily if any have come through. Just remember it's the orange button with the white arrow. But if you don't mind, I'm just going to ask a couple of questions. Given the fact that a lot of osteopaths do private practice, do you get, and setting up your own business is it's a really impressive thing. Do you get any skills or do you get any training to do that element of the job of setting up your own business?
Yeah, absolutely. So within the final year of our course, we had a module called practice management, and that was all about giving you the skills and exposing you to what it takes to run your own business and have your own clinic, because it's a whole nother almost degree to have to learn to sort of function a clinic and build a practice. But yeah, so as part of the course, you are taught what it takes to have your own clinic and set up. I would say I'm in the minority for those that have done it this early on. People tend to work for somebody else as part of their established practice, get comfortable with the profession and learn the skills before starting on their own. But for me, I think having worked in clinics before, I wanted to set off and do that from the get-go, which is why I've got my own practice so early. But you do come away feeling ready, and it's just a matter of if that kind of thing appeals to you.
Brilliant. All right, let me just quickly go over to Emily and see if we've got any questions.
Yeah, we've had one just come in. What kind of conditions do you treat?
Yeah, fantastic question. I meant to actually mention that in my presentation, so thank you for bringing that up. The most common thing I would say I see in clinic is lower back pain. And reason being, I feel, is because often we're sat very sedentary in our jobs. We never sit up perfectly. We're always slumped forward. And what that means is we get a tight upper back, and then the lower back becomes achy. Similarly, I see people with neck pain. I think phones can be a very common cause for this. Our necks are often in this compromised position. Neck pain, lower back pain would be the most common things that I see. Amongst that, I treat people with headaches. I see people with knee injuries, perhaps from sport, shoulder pain, quite often if they play racket sports, things like tennis, things like golf as well. But essentially, it's all of the joints, head to toe, people with wrist pain, foot pain. It really is varied, which is something else I love about my job, is that someone books in to see me and they could come in with any joint, any problem, and I've got to diagnose it, which is such a lovely challenge. So yeah, lower back pain is the most common, followed by neck pain, but then I can get anything from head to toe.
Great, so interesting. We've had a few more come in.
Yeah, go ahead.
One question is, what do you learn in the Masters in Osteopathy? So you said it used to be a 3-year degree and then it changed. What do you think's been added?
Yeah, so obviously I enrolled from the Masters from the get-go, and how it works, and it does vary from college to college, and I know there is actually a part-time course that's slightly longer and different, but essentially what happens with the Masters now is that you get a deeper level of knowledge, particularly in research, and that is what gives you that higher level as a Master's degree. So you actually carry out your own research in your final year that is fit for publication, that you could then publish if you wish going forward. That is the main differentiating factor. And also throughout the course, there are different parts of it that are at that higher master's level. So you may have to do a slightly more complex report or learn slightly more complex ideas, as opposed to it just being a standard 3-year degree. And I think throughout you just have that greater depth of knowledge. So I think that's what differentiates it from the Masters to the standard, but it also sets you in good stead in life in general, because you then got that high level of qualification that if you did want to do something different, you've shown and you can develop those skills and get a master's degree. So
great, thanks. Got another question. What sort of qualities do you need to be an osteopath? So thinking more soft skills here, I think.
Yeah, sure. So in terms of sort of qualities, I would say being able to deal with people, good communication skills, and I say empathy is a really important one as well. Every day you have people coming to see you that are in pain and are looking for a solution, and being able to be empathetic and empathise with your patients is a really important one. I think eager to learn and learn more is really important. Even once you finish the degree as an osteopath, and I would say as an AHP as well, there's always new research coming out, there's always new knowledge to learn. So it's important that you are hungry for knowledge and want to grow yourself as a person too. And I would say a passion for helping other people and of the human body, really. Ultimately, you're spending your time helping others and dealing with the physical workings of the body. So I would say that's a sort of attribute or a characteristic that is quite important too.
Great, so interesting. One more, got an interesting question here. Do you use much equipment?
Yeah, great question. So as osteopaths, we tend to mainly use our hands as our hands-on techniques. Some osteopaths use more equipment than others. Me personally, I have two main go-to, and that is K-tape like sports tape, and you may have seen this on footballers or athletes, and I mainly use this as an adjunct to my treatment. So for example, if someone comes to me with lower back pain, my main focus would be hands-on manipulation, soft tissue work, massage, mobilizing those joints in that body, but I may then use tape to support those joints once the patient has left, to support that structure. I also did a course alongside my university in acupuncture, or dry needling rather, and I sometimes use dry needling techniques alongside what I do. That is pretty much it for me. I know some osteopaths use shockwave therapy, which is another form of therapy to adjunct to osteopathy, but on the whole you won't see osteopaths using a huge amount of equipment, because the foundations of what we do is mainly using our hands to palpate and treat that way.
Right, one on the machine. So I've got another question. What would you say are the main differences between an osteopath and a physiotherapist?
Sure. If I had a pound for every time I would ask this question, I would be a very rich osteopath. But again, it's a great question and something that people don't tend to know. So I would say, in a nutshell, physiotherapists are equally as fantastic as osteopaths, but have slightly different skills. A physiotherapist is more commonly skilled to deal with a patient that's perhaps had an operation, such as a knee replacement or a surgery on a certain area, and they would rehab that patient through that process. Physiotherapists, albeit they are taught hands-on, they tend to be more exercise-based and more hands-off, although some do hands-on. As osteopaths, we do deal with patients that are post-operative as well, but our expertise, I would say, is dealing with the general public in general conditions that they come in with, and we are much more hands-on based and hands-on approach. So for example, you wouldn't really go to a physio as such if you had, say, just neck ache, lower back pain, or general postural complaints. I would say that's more suited to an osteopath as opposed to a physio. I do also use exercises alongside my treatment. I think it's important to empower patients with those things as well. But I'd say the main difference, physiotherapists are post-operative rehab, that's their speciality, whereas osteopaths, we're more general conditions and more hands-on.
Great, thanks for clearing that up. We do get that question quite a lot. Do you work much in tandem with other AHPs?
Yes, I do. Certainly people like podiatrists, people in diagnostics, and occupational therapists as well. Again, one of my main approaches is I like to integrate working with others. I think so often people can feel like, oh no, this is the treatment that they need, but the most optimal treatment for a patient, I would say, is to work together and give that person the very best care. We all have different strengths depending on where we've come from. So quite often I might be emailing someone to refer a patient to them, or receiving a referral, because ultimately it's what's best for that patient and what treatment is going to help them the most. So yeah, we do actually.
Okay, great. I think that's all the questions we've had come through, but I actually have one. Do you tend to see patients just once, or do you tend to see them every week or once a month or something?
Yeah, sure. So it really varies depending. I know it depends, a bit of a cop-out answer, but it does really vary. Sometimes a patient could come in, it's been a one-off thing. You know, they may have just got a trapped nerve or something within their neck, and it just needs releasing and manipulating. Some other people may come in and it may be a long-term chronic thing. For example, they may be a physical labourer and their job demands a lot of things from them physically. For those patients, it's not necessarily going to be one treatment that is going to fix a lifetime of using their body in a certain way, and therefore those kind of patients may then want to come back on a regular basis to have their body worked on by an osteopath and take more of a preventative approach to their health and well-being. Seeing an osteopath and having treatment, you don't have to be in pain. I strongly feel that anyone can benefit from seeing an osteopath, almost like seeing a dentist or going to the opticians. We are trained to look at you as a human body and point out different things that your body has perhaps developed or gone through, and then you may help that person on more of an ongoing basis. And in terms of how often people come in, it does really vary. My main aim is to give people the tools to help themselves, but some people do come in on a more frequent basis.
Great, we've got a couple more questions, they keep coming through. So what areas can you specialise in as an osteopath?
Yeah, so huge variety. Some of my colleagues from my course have specialised in paediatrics, which is treating babies, newborns and children. That is a whole nother area of osteopathy that has, I think it's a year specialist course for that. Other people might go into sports rehab. So some of my colleagues wanted to work within sports teams or footballers or rugby players, and you would then go and kind of venture down that route. Some people also go in to treat animals, so treating horses, dogs. There's a huge market for that as well, which is a great way to kind of link in with what you do as an osteopath too. Some specialise in pregnant women, so helping people in that sense and helping them through the pregnancy process. Some might go into geriatrics, so more elderly people and the conditions associated with that. There is a huge variety of specialisms, and I think that's really great about the profession as well, is that you can take it in whatever direction you want.
Great, lots and lots of areas to specialise in then. I've got one more question. Is it part of the HCPC, so the Health Council?
HCPC. That's not something I personally have come across. I have to research it and see. I would probably go no. I haven't yet researched, so I can't say for sure.
Okay, that might be something we'll have to look into and get back to you for your question. Okay, so I think looking through the questions, I think that's all of them. Apologies if I've gone over it and missed it, but I believe that's all of them. Chris, did you have any more questions?
Yeah, I've got a couple, just out of personal interest, Annie, more than anything else. So you mentioned that it's a never, you never stop learning in life. No, and I think maybe because I've done quite a few of these webinars, as has Emily, and we've met at various different types of AHPs.
Mm-hmm.
Is there a good sort of community within osteopaths, as in sharing good practice, good knowledge? And do you go to, in the days of old, would you go to conferences and things like that? To because I noticed that you've won awards as well, haven't you?
I have, yes. So yeah, there is. There's a great community. As osteopaths, we have something called the Institute of Osteopathy, which is a fantastic organisation that essentially keep all of us together and building a community. Every year there is the IO Convention, which is a huge organisation. Unfortunately, we haven't had it this year, but where all osteopaths come together. You have talks from top people in their field, and that gives you the chance to develop your knowledge, keep yourself topped up, and hear from those in different areas. As part of that, there's a lovely gala dinner as well, where you all get dressed up. We had a fantastic one this time last year, and people are recognised for what they've achieved. So last year I was fortunate to get the Rising Star Award, which is those new osteopaths coming into the profession recognised for their potential to make a difference, which is amazing. And also on a bigger scale, there's lots of CPD courses, so continual professional development, all throughout the year, online, offline, where you can go and develop new skills to help your patients even more. And you are actually required as an osteopath to continue practicing, to continually update your knowledge and prove that to your registration. So that involves others watching you, you networking with other people, and showing that you are passionate and conscientious about developing your skills.
Brilliant, brilliant. Well, congratulations on being a rising star. So where would you, I mean, one of the things I'm passionate about is people picking careers, and so being able to develop your time and your energy into that profession and being rewarded for it in terms of intellectual opportunities, training and development. So where would you see yourself in 10 years' time? Do you have any goals of where you would like to be, and how are you going to achieve them?
Yeah, so it's incredibly exciting. I, as I said at the start of my presentation, I really love giving back and helping other people. So what I do see myself doing is, once I've developed my skills even further, is pay that forward to other students. I've actually set up a community already for osteopathic students to build more of a community for them. And I would love to help mentor and grow other osteopaths into the future. I also think what we were speaking about before, where different AHPs integrate, I really think that is the most optimal way to help people. So I'd love to set up my own larger clinic where there's a variety of different people working together in an integrated way, almost like a one-stop shop for a patient that could then have all of the best things from all different AHPs. And also just thinking about different ways to help people in this ever-evolving online world we're moving into. What I do as an osteopath is hands-on, but there's a huge amount of value we can also give in a virtual way in terms of advice, support, supporting a patient sort of psychologically as well through whatever they have going on. So it's exciting to think about how that may be integrated into practice in the future, as well as social media and the internet. I have an active social media platform where I'm sharing tips and advice all the time about my journey and my experience. So who knows where that may take us, and you say working with other people. So.
It's hopefully it's not out of place. I'm very jealous of you. I think you've got a wonderful outlook in life, and you've got a really good job. And I think hopefully Emily will agree with me. We have many guest panelists, and you've really sold the profession certainly to me. So
yeah,
my last question is, can people retrain? Because I mean, you are relatively young. That's hopefully take it as the words. And I am I'm in my 40s. I don't know how, but there I go. So if not just students are watching this, can people? How easy is it? What advice would you give someone who's maybe had a career and said, actually, I want to do something. I want to help people. I'm interested in all this. What advice would you give them?
So first thing I would say is that on my course, and this is the one thing about being an osteopath that's quite unique in studying, there is probably a 50-50 split between those coming into onto the course straight from sort of school and A-levels or equivalent, and those doing it as a second career. I think the oldest person in my course was around 50 when he enrolled. So yeah, 100%. I think if you are, say, if you're not a student, you're later on in life and you've gone through the process, and you wake up in the morning and don't look forward to what you're doing, 100% consider changing and doing something. I think it's important to share that although I've painted osteopathy in a very positive light and I love what I do, there are days when it is stressful. There's a lot of pressure on you to help others, and it's important to recognise it's a challenging profession, and the course is incredibly challenging and there's lots that you need to learn, but providing you lead with your passion and your vision for what you want to do, you will get through it. And as long as you put your effort in and you drive yourself through, it is so rewarding. There is nothing better than someone coming through your doors and within a session or a couple of sessions you've changed, number one, their pain, and number two, their life, and number three, their perception of what they can then go on to achieve. It's it actually makes you emotional to be able to help people in that respect. So it is never too late. Even having said that, I think there are people that have started even later than 50, so it's never too late, and I would always recommend to follow your passion.
Brilliant, thank you. So it's not too late. It's not too late for me then. Emily, do you have any questions?
No, I think I've answered all my questions.
Okay. Well, I think we should end there, because it's nearly been an hour, and this has been one of my most enjoyable webinars that I've presented. I think you've really sold the profession, Annie, and it's been a real privilege to have you. If we have what we have just on the screen, we have our email address, info@icthedifference.co.uk, and our website. Emily, if we do have any questions, Annie, if we don't have any questions which Emily and I can't answer, would you mind awfully if we forward them on to you to see if you could help us out, just if we do get any questions?
Absolutely. Honestly, if anyone has any other things they want to ask, then please do forward them on. I'm more than happy to email, telephone call, whatever. And I hope this is okay to say this, but if anyone just want to follow my journey, then I am also on social media as Annie the Osteo. So if anyone is keen to see what it actually is like in the life of an osteopath, then that is where you can find me day to day.
Brilliant. Okay, so Annie the Osteo. So this webinar has been recorded, so anyone wants to hear more or just re-go over what Annie was saying, this will be made available in a short while. Please email us with any questions. All I'm going to do now is not ruin what has been a fantastic hour by wittering away. So I'm going to say thank you very much, first of all, to my colleague Emily for moderating and fielding all those questions. And most of all, because Annie has not only given up her time for today, we've had to arrange some practice webinars and sort out IT issues. So you've given up more than just an hour of your time, and myself and Emily and the rest of the team are really appreciative. I hope our audience is as well. You've been brilliant. You've made me got a lot to think about, changing my life. Probably sit. You're probably criticizing the way I sit.
Yeah, exactly.
I'm wittering. Right, Emily, Annie, thank you so much. Everyone, be safe, keep well. Please get in contact with us. I see the difference. If anything Annie's inspired you, we'll hopefully give you all the information you need. And hopefully, Annie, you've inspired a new generation of osteopaths.
That is the aim. Thank you so much.
That's the aim. No worries. Take care. Have a good rest of the day. And thank you very much. Bye, everyone.